Health Watch is presented by UMass Memorial Healthcare. Here, caring for you.
Welcome to Health Watch, presented by UMass Memorial Healthcare. I'm Brittany Schaefer. Today's topic is pediatric heart murmurs.
All a heart murmur is an extra sound that blood makes as it flows through the heart. These are very common things, especially in kids. And sometimes they can be indicative of an underlying heart problem, but more commonly, especially in the pediatric population, it's not a problem at all. Heart murmurs are much more common when kids are sick with something else, and it's oftentimes in those cases that an innocent murmur in particular might come about that you didn't hear before. And those innocent murmurs can come and go over time.
Does someone with a heart murmur experience any symptoms?
Some heart murmurs that are indicative of heart problems can result in symptoms, things for example like difficulty exercising, shortness of breath, chest pains, palpitations, things of that nature. A lot of the problems that we diagnose in the pediatric population, they're structural problems, but they're small structural problems. For example, small holes between the different chambers of the heart, subtle valve problems, that sort of thing. Rarely, some of these problems will require more invasive therapy like a surgery or a catheterization.
Should activities be restricted for children with heart murmurs?
Most murmurs that are diagnosed are innocent in nature. We're able to suss out if there's anything to worry about and recommend the appropriate testing and therapy if it's necessary.